Since PAD is often underappreciated, healthcare providers need to be aware of elevated infection risk in patients with PAD. Then providers should consider any available preventive strategy of infection, such as vaccination. I'm a Dr. Yejin Mok, Research Associate in the Department of Epidemiology at Johns Hopkins School of Public Health. We studied approximately 5,000 participants aged 60 years plus from the ERIC study, which is a community-based cohort study. We defined PAD as a clinical history of PAD or ankle brachial index less than 0.9. Then we investigated whether PAD was associated with infection-related hospitalization. We found that PAD was robustly associated with infection, even after accounting for potential confounders such as diabetes or smoking. Interestingly, borderline low ankle brachial index of 0.9 to 1.0 was associated with infection as well. We observed similar results across 4 major subtypes of infection, such as cellulitis, bloodstream infection, pneumonia, and urinary tract infection. Although the contribution of PAD to infection risk was comparable to coronary heart disease or stroke, the risk of bloodstream infection and urinary tract infection was greater in persons with PAD alone than those with coronary heart disease or stroke alone. In addition to vaccination, there are some preventive strategies for hospital-acquired infection. These are generally applicable to every patient, but it would be important for patients with PAD receive those preventive strategies. Similar to providers, probably the first step is to recognize elevated risk of infection when they have PAD. Although the guidelines recommend annual influenza vaccination for all individuals, vaccination rates are often suboptimal. In this context, improving the uptake of vaccinations would be particularly important for patients with PAD. Our study is the first to investigate the infection risk related to PAD in the community-based cohort study, so our findings should be confirmed in other settings. Then an option is to develop a vaccination program for this clinical population, probably involving these multidisciplinary healthcare professionals, such as primary care physicians, cardiologists, nurses, and podiatrists. Finally, we should improve awareness of PAD in the medical field and the general community.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.